Hey guys, all right. It's come to my attention that a lot of you are still experiencing incontinence, as evidenced by some of the comments on this 21.1 with all the jumping and then getting upside down and jumping, getting upside down and jumping. A lot of core strain potentially happening in this workout. And so I wanted to make a video of some things you can do to help really address the cause of the incontinence, urinary leakage. Remember, in females, we'll tend to have leakage like when we jump or sneeze, or catch like a heavy clean. In men, incontinence tends to look more like fecal incontinence. So men aren't immune to it. They just probably don't talk about it as much as women do. But it's absolutely not normal for you to have to go put a maxi pad in or put a diaper on before you do double unders. And it's fixable in most cases. So, and it's not like something has to happen when you've had a baby. A lot of us don't have any incontinence and we've had babies. So, but it is important to find the cause of what's going on with it. So when we look at the core is not just your abs. The core is the entire, like all the musculature around the abdomen, plus your diaphragm on top and your pelvic floor in the bottom. So it creates this cylinder shape, okay? So when that cylinder shape is working properly, moving properly, when the muscles can contract and relax properly, pee stays in where it's supposed to stay. When we have muscles that don't turn on when they should, or that don't relax when they should, that stay contracted, a lot of time we will have what shows up as incontinence, urinary or fecal, or like pelvic pain, even like back pain, things like that. So I'm gonna give you some tools to address some of the causes. And this is good for guys and girls, although I have a feeling mostly girls are gonna be watching this. But if you poop yourself, men, you can watch this too. So first, in CrossFit land, I think what we see more of is a pelvic floor that's actually too tight. And a lot of us have been told, like, it's all about Kegels and staying tight, and we want tension, contract. You should never have to feel like you're squeezing your pelvic floor to prevent urinary leakage. Your pelvic floor should naturally turn on. No, I need this. Xander's with me. So if your pelvic floor is too tight, because you're squeezing, say you're doing double unders, you've been squeezing, and we do a lot of squats, we do a lot of sit-ups, we do a lot of things where you might be walking around squeezing too tight. Or after like childbirth, sometimes your body will actually spasm up that muscle to protect the structures underneath. And then in that case, what happens is the muscles stay tight and they can't lengthen. So a muscle that stays tight and can't lengthen is not functional, right? If I took my bicep and I keep it tight here and it can't move here, do you see that I can never actually use my bicep because it's already at full contraction? So I couldn't lift a weight. Just like your pelvic floor, if it's already in contraction, it can't contract, relax to actually keep urine in and help stabilize your whole pelvis when you're squatting, when you're doing double unders, when you're doing sit-ups, any of that. Can you please stop that? Children. Well, stop, please, or go do it somewhere else. So the first step for everybody on this line, on this video, regardless if you know your pelvic floor is too weak or you know it's too tight, we're all going to do some relaxation of the pelvic floor, and we're going to use some kind of tool. So I have the Courageous Ball. TuneUpFitness.com, it's backwards for you, has a really nice kit, and it has a Courageous Ball and it has several really nice fascia balls that you can use for different body parts, but I like this one for pelvic floor and for core. So what you're gonna do with this, you have it, where's the foam roller? Go get the foam roller. I don't know, where did you take it? I had a foam roller too. Please go get me one. So you're gonna take it and you're just going to straddle, not like a massive straddle, but straddling it here, and you're gonna hold and you're gonna breathe. Big diaphragmatic belly breaths. In through your nose, out through your nose. So my belly is actually gonna expand out. As I breathe in, my belly expands. As I breathe out, my belly contracts. So what happens when we breathe is our diaphragm, when we breathe in, moves down, pelvic floor moves down. When I breathe out, diaphragm moves up, pelvic floor moves up. So we're using breath to actively release the muscles of the pelvic floor. Okay, so you should feel the grippiness of the ball like in your pelvic floor, and you might feel the muscles start to kind of relax and soften. If you don't have one of these balls, mine obviously has a hole in it. Xander's getting me foam roller. Throw it down here, buddy. Throw me foam roller. Quick, quick, quick. Just drop those. Give me foam roller. 1 minute. Okay. So sorry. So we can also do this with a foam roller. It's not quite as nice feeling, but you can straddle a foam roller as well. And you'll just find that spot where you're on the muscles of your pelvic floor. And there's nothing weird about pelvic floor. Pelvic floor is just part of core. So again, this is important for men and women. This is not just like, if you pee yourself, do this. This is anybody who wants a functional core. It's gonna make you a little bit stronger, more stable, helps back pain. So we're gonna do the same thing, breathing in and softening into the foam roller. And you might find areas that are like tender or tight, especially if you do have one of these tight pelvic floors. So I would do about 5 minutes of deep breathing on a ball or on a foam roller, or even like a large lacrosse ball. What? Okay, it's okay, leave it. Before you start activating the muscles. The next thing we're gonna do is we're gonna find bear position. So we're gonna get into tabletop. This is really great for activating posterior chain, but also activating the pelvic floor in the way it's supposed to work. And we're gonna use our breath to help strengthen. So we're gonna get up on our toes, go into a high bear. So with a neutral spine, lifting your pelvis to the ceiling. And here I'm gonna hold for 5 diaphragmatic breaths. Breathing all the way down into my pelvic floor. Okay, and then softly coming back down. So it's important to make sure the butt is higher than the shoulders, but that we keep neutral. So we don't wanna be here. We also don't wanna be here like down dog, because we're not neutral anymore. We just wanna be here. It's a really nice stretch on the pelvic floor, but it's gonna help activate properly. Anytime your pelvis is actually elevated or level with your shoulders, like in bear crawl, when we see them in the WODs, even just crawling, even just tabletop, that's gonna be really good for strengthening so that it can stop your incontinence. The other thing is this belt. So some of you have probably seen me wear this belt. Dr. Jim has this belt. Several people have this belt. And this is not like a weightlifting belt, it's a Core 360 belt. So it has these little balls in here that when you wrap them around, it kind of gives you like tactile feedback on your core so that you can feel when you're breathing properly. So when I'm breathing properly, I'm bracing in, my belt feels like it stretches, and these little balls kind of push into my core, and I think of pushing them out. We want to create that pressure from an inhalation, so brace. Okay, so before we do something like double unders, I might wear a belt like this if I had incontinence, or I might, not. It's harder to create the pressure without the belt. I might create that pressure and then go. Okay, and in this position, now my pelvic floor is naturally activated versus, just squeezing. A lot of people create stability by breathing out and crunching down. In this position, my uterus and bladder actually go down, and that's going to increase your leakage. So some people can stop their leakage enough just by creating the proper pressure when they're doing double unders or jumping, like box jumps, anything like that. So I like using this even just to facilitate my breathing and my warm-up. The other thing that we can do is a glute bridge before we work out to get our posterior chain firing. So with your heels tucked into your butt, thinking of rolling one vertebra at a time. So first it's a pelvic tilt, pressing through the heels and lifting as high as we can without arching our back. So I don't want to go here. I want to lift, keep everything neutral, hold, and slowly return back down. So it's going to wake up all those muscles down there that maybe haven't been functioning properly. So it's, a 2-part process. We have the lengthen and the relax and the soften and the breathe, because we have to get a muscle that can contract and relax. Once our muscle is functioning properly, then we want to turn it on in the correct pattern. And that's what's ultimately going to stop the incontinence, stop the leakage. But this is something you have to do on your own. You really need to be probably doing it every day or every other day, especially if there's jumping in the WOD, if you want to correct it. Long term, if you don't correct the cause of your incontinence and your leakage, that can look at like prolapse, so like bladder prolapse. That can look like uterine prolapse, stuff coming out that shouldn't be coming out, right? And you shouldn't have to pee your pants unless you're a toddler or a baby. So we can help you. These are just some quick tips. Obviously, like one-on-one, we can check your core. Lydia also is really good at knowing how to check core. Kelly knows how to check core. So find someone and we can help you. And you don't have to pee yourself anymore. But these are just quick things you can do, hopefully before this open WOD, so that you're not having to wear Depends. Because it's not good. All right, ask me questions. Good luck. Keep the pee in, keep the power out. Bye, guys.